things we know less about are now, what is the appropriate medical care? I think we're struggling to try and figure out how do we care for these millions of individuals who happen to have a history of cancer and who are back in the healthcare system. What kind of follow-up do they need? Do we need to be doing something special for them or different for them? Can we, in this new wave of therapies that are being developed, develop less toxic treatments? I think that is a continuing focus and a challenge for us. Are we going to answer it with molecularly targeted agents? I don't know. I think we don't have the answer for that. But I do know that any of those new treatments, unlike in the past, aren't going to be just taken out into the community. They're going to be looked at with regard to their long-term effects. That's because we now think about survivorship from day one and going forward. That's a very different world in which we live. Another growing area to be concerned about is caregivers. We've suddenly realized, oh my gosh, that was in the definition of survivor. Caregivers are included in that definition of who constitutes a survivor. And we're only just recognizing, we're not meeting their needs. They're an important part of care, and yet we don't really understand how to support them, how to best train or educate them about what their role is, give them the skills that they might need to really help a loved one through a course of treatment and beyond, and take care of their own health if they may be at increased risk. Big new area that we need to be thinking about. And perhaps a final one that we know very little about. Surprisingly, lots of researches we've seen with young survivors, because that's been our vanguard group, we actually know very little about older people who live with a history of cancer, those 65 and older. It's a gap area. It's shocking because that's going to be the fastest growing survivor group in the country because of the baby boom generation and the fact that cancer is a disease associated with aging. We have really no data on what we need to be doing for older adults and their caregivers and their networks and their providers. What are we going to tell them about caring for themselves, about the care they should be pursuing, about what kinds of interventions may be needed for them in particular, and how do we do that?